group, I think, and others have covered, and I think even in American Thought Leaders, some of the other pieces where you interviewed Ryan Cole, this was discussed. Pseudouridine is immunosuppressive. Pseudouridine incorporating RNA is having half-lives of 60 days or longer, which is totally unprecedented. This is not a natural RNA by any stretch of the imagination. It's not behaving as RNA. This fact, published in Cell, observed by a strong group from Stanford University by lymph node biopsy. This is not in cell culture in Petri dish. Okay, this is in human beings after being injected in their deltoid and sampling by fine needle aspiration in their axilla. These RNAs are sticking around, continuing to produce high levels of protein, of spike protein, for 60 days or longer. They didn't test beyond 60 days. And the levels of spike protein being produced are far in excess of the levels that are observed in your blood after you get a natural infection. That now makes sense out of some of the adverse event profile. One of the things that's been confusing, why would you see more adverse events with the vaccine than you would see with the infection? Well, now we have data showing the level of spike protein is much higher after the vaccination in your blood compared to what you get after you get an infection. So it's the sum of the all-cause mortality, this increasing granularity of knowledge and acknowledgement of the broad spectrum of adverse events, the clear lack of effectiveness. These vaccines are not stopping infection, replication, and transmission, something the Washington Post called me a liar for saying when I said it on the steps of the Lincoln Memorial, and yet here it is, it's widely acknowledged, just as I observed back then. They're not acting like vaccines. They're not providing durable protection. The data is increasingly demonstrating that these products are in a dose-dependent manner. That's key for scientists, okay? If you want to have a causative relationship between a drug and an adverse event, you want to see as you give more drug, you get more adverse event, right? Makes sense. We're observing that now. And we're observing the cardiotoxicity, the cardiologists that are looking at this in a more and more granular way, let alone the anecdotal of this, the high-performing athletes, the weightlifters, etc., spontaneously expiring, I'll make that gentle, on the field in the middle of high-performance sports activities at rates that seem to be unprecedented. Despite all that, we're now seeing more and more data that the cardiotoxicity, the myocarditis, is actually quite prevalent. If you just rely on clinical myocarditis, that means that something has caused so much damage that it causes you to go to the hospital. Okay, we call it a grade 4 adverse event. That's a big deal in medicine. A drug causes you to go to the hospital. That's a big deal. What we're seeing is that now the cardiologists and others have become sensitized to this risk, and the tests that can be performed, like troponin assays and certain types of MRI scans, functional tests, we're seeing evidence that it may actually be the majority of particularly young males that receive these vaccines are having cardiac damage. Furthermore, it's long been known that myocarditis, on average, before the vaccine, of any cause, viral or otherwise, had something like a 15 to 20% mortality rate at a 5-year horizon. As the data is going by, because remember, it hasn't been that long, what the cardiologists are telling me is that they're observing morbidity and mortality, that's disease and death, that is tracking along those same lines as would be observed with classical myocarditis. So you'll recall that as the CDC disclosed that myocarditis was a problem, and I think we discussed this on our prior interviews, the story promoted in the press, how else do you say it? We can call it propaganda, in my opinion, but whatever it is, that messaging, the approved messaging that was promoted in the legacy media, mainstream media, was that this is mild myocarditis, and the children are recovering, they're not going to have problems with it. That's not what the data is showing now. The data are showing that these young boys in particular, but it's also young girls, just at a lower incidence. There seems to be a testosterone factor, cofactor in this, but they're not recovering. As I've been saying all along, heart muscle doesn't heal, it scars. And I fear that not only do we have this cancer risk, but we have this long-term heart damage risk. Now, I was also interviewed on Monday by Del Bigtree together with Ryan Cole and Richard Urso, and they very much focused in their prognosis long-term on the T-cell damage and the consequences of that and potential consequences. And so Del turned to me last, and so I got that cleanup, and I mentioned the cardiac. The other one that's coming out now, more and more, it's still anecdotal, and it's clear that obstetricians and pediatricians have been strongly encouraged, let's say, to not report these things. But there's more and more data coming out. Not only do we see dysmenorrhea or menometrorrhagia, these alterations in menses, like the observation of the elderly postmenopausal women that suddenly start having menses after taking the vaccine. That's a very odd finding. It suggests something with the ovary. We know these lipids go to the ovary because of the Pfizer documents. Okay. Now we're hearing these reports of spontaneous abortions, birth defects, and paradoxical infant death shortly after delivery that seem to be tracking at significantly higher rates than is normally observed. These are all things that can occur during pregnancy. They're known risks of pregnancy, but they have very well characterized rates. And this has been a worry. And again, you'll recall that on the basis of very scanty data, there were strong statements encouraging by the CDC that women should take these experimental products during pregnancy. And now the data is coming out in multiple threads that suggest there is, in fact, reproductive toxicology problems, which is something that I've also been warning about, as have many of my colleagues. So you ask why? Why such a controversial statement? We should stop these injections. I'll just read it again. We declare and the data confirmed that the COVID-19 experimental genetic therapy injections must end.
What I'm hearing is that there's a heck of a lot that's yet unknown, and there's all these signals that need to be studied at length, clearly, right? And at the same time, there's this other piece, which is just that this is actually treatable, right?
Precisely, and preventable with vitamin D. That's the other shocking thing, is that there are virtually no deaths from this disease in people who have vitamin D levels in their plasma, in their blood, above 50 nanograms per mil.
Okay, I mean, how can you know that? That is an astounding thing to say. I mean, I understand that vitamin D is very important. I've learned that. But
there's actually many studies out now, including double-blind randomized placebo-controlled trials. And it turns out that this is a thread that goes back to 2006 with influenza. You may or may not recall the day that I went and spoke to the truckers up in Hagerstown. And paradoxically, that same afternoon after I'd given that speech, I had a call out of the blue from a physician. He has intelligence community ties. And this researcher was part of a team that had undertaken a study in which they data mined. They looked at the data records from the Department of Defense Health System for warfighters and looked looked at the morbidity and mortality, because when they get influenza, they're not ready for battle. So that kind of matters. And he was given the task of analyzing these data and try to figure out what the cofactors are to differentiate between the ones that were taken out by influenza and incapacitated versus the ones that were just shrugging it off and staying functional. And what he discovered was clear, statistically rigorous proof that vitamin D levels explained those differences. The story he tells me is that he was assigned to go visit Dr. Fauci, thinking, he's going to get, this is important information. We're going to invest all kinds of money and promote vitamin D based on your exceptional work and findings of your team. Instead, what he got told, per his relating the story to me, was the phrase, "We don't use drugs to treat influenza. We treat influenza with vaccines only." And with that, it died. The point is that this policy that we've seen roll out here with this particular RNA respiratory virus and its role in vitamin D goes way back to the mid-2000s when the same leadership at the National Institute for Allergy and Infectious Disease made a clear and unequivocal decision to not pursue the importance of vitamin D in preventing respiratory disease. The data are indisputable. Vitamin D at sufficient levels is necessary to support the health, particularly your T-cell population. What a surprise, we keep coming back to that same thing, okay? And it costs pennies. The thing that I find most astounding is the reports that I hear again and again from patients that they went to their doc and they said they wanted their vitamin D levels tested, which is a simple test, inexpensive, and their doctor refused to do it. It is such a simple thing, it would cost pennies, it would quench this outbreak. And if we're really worried about resurgence next fall, if we're really worried about Gert von den Bosch's troubling predictions, we would do as Bill Gates has now endorsed. I mean, we have, I hate citing Bill Gates in anything having to do with public health. The man never even graduated from college, let alone medical school, or get a PhD. But he is considered to be such an important voice in public health by the legacy media and by governments all over the world. And he's the major funder, as I understand it, of the World Health Organization. When he comes out with a statement that we blew it, basically paraphrasing, by focusing only on vaccines, and for the next outbreak, the next pandemic, we have to be ready with drugs, I find that fascinating because it has been my position since January 4th, 2020, when I got that infamous phone call. That's why I focused on repurposed drugs, because in my opinion, as a vaccinologist, vaccines are good for some things. They're not good for everything. I always use the phrase, give a 3-year-old a hammer and everything becomes a nail. And for some reason, the NIAID and our entire public health infrastructure has elected to just focus on vaccines and promoting new vaccine technologies in particular, and hasn't allowed other alternative approaches, including approaches that just have to do with good health, that can have such a huge impact on your risk from this disease. That diabetes and obesity, in addition to extreme age, are our biggest risk factors. And those are lifestyle preventable diseases. And even in the face of diabetes and morbid obesity, which by the way interferes with vitamin D availability, so those are interacting variables, we can have a huge impact on the risk by strengthening people's immune systems with just giving them not just enough vitamin D to prevent them from getting rickets, which is like the obvious baseline thing, right? But enough vitamin D to keep their immune systems functioning. This is particularly important for African Americans and individuals of color operating in northern climes and working in an office space and things like this. Their skin coloration is designed for latitudes where they're exposed to a heck of a lot more sun. And that's no longer happening. It doesn't happen here in the northern hemisphere, and they are highly susceptible to very low levels of vitamin D. There's other genetic risk factors that have been identified that are curiously aligned with this virus, but in particular, there's a good chance that if the government would just do some simple public health messaging saying, go get your blood levels drawn and get your vitamin D levels up above 50 nanograms per ml, it's going to make a huge difference. That it would cost pennies. And it is important to get your blood levels tested. A lot of people often will ping me and say, oh, can I just take more vitamin D? Well, the answer is maybe. You can get toxic from too much vitamin D. And different people absorb vitamin D at different levels. As I mentioned, your body mass index, your obesity and things like that will modulate your free vitamin D, which is what matters. And the test is cheap. So get the test and get some guidance. It's a simple counseling to say, hey, you should take this much vitamin D. I had low vitamin D levels. When I got infected and had severe disease in February, my vitamin D levels were down in single digits. I should have been taking more vitamin D. It's not, I'm not perfect, and none of us are. We've learned all these things over time. But you ask, are the data there? They are. I am not